Well, thanks for joining us again this morning, Dr. Collin B. Peterson. Collin B. Peterson, General Dentistry. Welcome. Thanks for being back on the show with us.
Thank you for having me.
So we're going to talk today about a subject that is near and dear to a lot of our hearts, whether we like to admit it or not. It's one of those things that just kind of happens for a lot of individuals when they walk into the dentist's office, even if they're just coming in to get a cleaning, and that is dental anxiety. And that, I don't think that your industry is helped by Hollywood, because there's a lot of myths on television about dentistry. There's like horror movies that have dentists involved, and so you're not getting any help from what people see. But kind of tell us, where does that anxiety come from?
So a lot of times people have anxiety through childhood trauma, past experiences at the dental office, even their parents' past experiences at the dental office. A lot of times you'll have that child in there saying, my mom told me or my dad told me this, or, when I was a child, I had this happen. And that's one of the main causes. But there's also another facet to that, which is shame. People are embarrassed. They're ashamed, how their smile is, or, their past that may have caused that. So a lot of that is self-consciousness too. And that creates a lot of fear and anxiety because they feel like, there's no way to fix it. So,
you can have a hurt thumb or a hurt knee. Nothing hurts like when you have something wrong with your mouth. Like even when you bite your tongue, like that stays with you for a couple of days, and it's there. Like I've bitten the inside corner of my mouth a couple of days ago, and it's still bothering me right now. And it's like you can't get away from that, and that's a large piece of it too. Because in order to help that, you're going to have to go through the process. And so, what do you say in terms of like people that are fearful of dentists? What are the statistics? Like, what percentage of people? It seems to be a lot.
1 in every 6 adults have dental anxiety, which is a pretty substantial number. And a lot of times people don't even admit that they have anxiety or even know that they have dental anxiety until they're in that dental chair. So I think one of the main forefronts is being able to recognize that dental anxiety, because sometimes you'll have patients that come in and they'll say, no, I don't have any dental anxiety. And then halfway through treatment, you're like, okay, so let's try to backtrack a little bit and let's try to stay calm. So that's one of the things that we really look for is the signs of dental anxiety too, because like I said, some people are not even aware that they have it.
So as we're shooting this segment, there's at least 6 adults in here. So scientifically, one of us right now has got a little anxiety, despite the fact that we're not even getting a treatment today. So just FYI. What are you guys doing? You're taking a completely different approach to dental care as a dentist, and even for your clients, or for your patients. So what are you doing here in the office to help navigate that, to help relax the whole process?
So many things that we do kind of coordinate together. First thing is communication. So communicating with patients, seeing what they're fearful of exactly. Is it the actual pain that they're fearful of? Is it just the atmosphere? What is it exactly that's causing the root of their anxiety? So that's one thing. Second thing is explanation and education for the patient. We're able to explain to them what is about to take place and the treatment steps that's going to get them to where they need to be. A lot of times they don't even realize how simple that step process is. They think it's much more complicated than that, and there's much more involved than what there actually is. So that's 2 main things. Another thing is just being able to create a calm environment, very soothing. You don't want to have a lot of high sensory noises and visual, representations in front of them, because there's 2 types of anxieties. There's the type that's just internal, where people are just, freeze up and they're not speaking. And there's also the external type, that panic, where they're ready to just flee outside the office.
Sure.
So, those are the 2 main types that we deal with. So we have to really establish and point out which type they are and be able to, adapt to that.
Right. Also technology is a large piece of what you guys do here that's different, because, when you walk through the building, this doesn't feel like a dentist office. It doesn't smell like a dentist office. The standard sounds that you hear aren't the sounds of a dental office. It looks and feels, based on what you have and the technology in your rooms, fundamentally different.
Yes. So one of the main things that we really wanted to emphasize when we built this office was, how is someone going to feel when they walk in here? Are they going to feel anxious? Because we want to try to eliminate that. So even the tones and the colors and even the elements that we use, the materials, create a soothing, calming effect where they feel like they're walking into a home. They're not walking into that sterile, cold dental office that has no feeling and no warmth to it. So that was the first thing. Second thing is we do have substantial technology that we use here. One thing is, we do a lot of digital scanning now, and that's eliminating all the gagging, goopy impression material that's, running in the back of your throat. No one enjoys that.
No.
So we revolutionized that to where that's no longer a thing at the dentist. So that's one major thing. We also do a lot of visual representation, education. We have a lot of visual displays that we'll talk about. And that really instructs and shows the patient what we're dealing with, and it gives them knowledge to where they're not fearful of it anymore. So those are big things that we talk about. We also do vibration anesthesia. That also helps with pain tolerance and
vibration anesthesia.
Vibration.
You're gonna have to dig into that one a little bit.
So basically, we're tricking the pain receptors. So
okay,
you're getting an injection. That doesn't feel good, right?
Right.
So especially in the mouth. So when you get that injection, we try to distract your body with the vibration to where it's
focusing elsewhere.
Doesn't even realize that you're getting the injection. So we have different tricks that we can use. And then aside from that, we're really trying to just observe and try to calm the patient in the atmosphere.
Pace is another one.
Yes. So pace, a lot of people don't like being overwhelmed. That's another big factor for anxiety. If you're dumping all this treatment on somebody, if they have the ability to pace that out and go at their level of treatment, that's a huge advantage in treatment, because we will eventually get there, but sometimes you need baby steps.
Yeah, it's a big piece.
Sometimes it's too much for someone to undertake at one time. So
we got a little bit of time, about 45 seconds left. Kind of give us a brief rundown. Your folks are trained in dental anxiety management.
Yes.
Just kind of cover that high level for us.
Every staff member here is trained in dental anxiety management. And what that means is we're able to identify, treat dental anxiety on many different levels. We're able to look at each individual and target their specific needs as far as which anxiety they have, and able to coordinate that, because everyone's different. Like I said, there's two different types. You have the internal, who keeps everything inside, and you have the external, who will let you know what's bothering them. Sure. So that's really important to locate, and that's one of the main things that we use here.
Caring for the patient. Really, you're coming in the door. You're coming in the door because you have a toothache or you need a cleaning. But here at Collin B. Peterson General Dentistry, they're caring for the overall patient and the well-being of that patient. You see that number at the bottom of your screen. You see that information there. Give them a call, and they will get you on the right path. Thanks for being with us today.